community participatory research, or CBPR. I'm going to just kind of dip into these topics because we only have about an hour today, and normally I actually have been teaching a course at UND, and we are able to get into this in a lot more detail. So hopefully we'll be able to kind of get introduced to some of these topics a little bit, and I will try to leave some time for questions and discussion at the end. So I just want to acknowledge first, before I get started, that a lot of the content that I'm going to be talking about today was done in partnership with several folks. Dr. Elvina Maris, who is a clinical psychologist with the Colville tribes, formerly of the Behavioral Health Department with the Colville tribes, and also Dr. Sarah Waters. She is based at WSU here in Washington State, have been partners of mine for about 6 years now, working on the project that I'll talk about later on today. And I'd also like to recognize two students who've been working with us for a few years as well, Mina Richardson and Fawn Harris. This project was funded by the Robert Wood Johnson Foundation and was part of the Interdisciplinary Research Leaders Program work that we did together throughout. And then this year, we were able to secure additional funding through the University of Washington Population Health Initiative's Tier 2 Pilot Research Grant Program. And so I want to acknowledge those sources of support. So first, I'm going to start off with a little bit of an overview of culturally grounded interventions in Indian country, and then I'll talk in particular about some of the research and evaluation approaches, in particular CBPR, that help support cultural interventions and development of cultural interventions. And then I'm going to share a little bit about the Stimasbus intervention that I've been working on with Dr. Maris and Dr. Waters and our two students, or What's in Your Heart, which is the Okanagan translation, or English translation of the Okanagan word. So I think, one of the big pieces of development in research over the last 10 to 15 years now, actually probably about 20 years, is the fact that culture is really integral in terms of American Indian, Alaska Native behavioral health research, and can serve as a really important piece and component to intervention work in Indian country. I want to share some of the seminal work that was developed by Dr. Spiro Manson and his colleagues, Dr. Jan Beals and others at the University of Colorado. This was conducted, I think, in the early 90s, and they were able to conduct some of the very first large-scale epidemiology survey work and interview work with tribal communities. And this is really important because this particular paper points out the fact that between these two tribes, a Southwest tribe and a Northern Plains tribe, we see significantly higher use of traditional healers among members of the Southwest tribe who were also reporting substance use disorders. And so this was kind of the first quantitative data that suggested that there are actually differences between tribes. It's something that, of course, we recognize now. That wasn't always the case. Sometimes still isn't really understood fully by folks who don't work and live in Indian country and do research in Indian country. But this was really important. We don't really know, why that might be the case. It may be perhaps that members of this tribe in the Southwest were able to access traditional healing through their health centers. It may be because culturally there are prohibitions for the Northern Plains tribe that participated in this research program or research study that doesn't really facilitate them accessing traditional healing within the care settings that they had available to them at that time. But it is important, I think, to underscore the diversity across tribal communities and how utilization of traditional healing can differ by region and tribe, and also gender. Another early study, and this is from 2013, in a Northern Plains tribe, underscores the fact that culture could perhaps inform behavior, including understanding of health knowledge and by extension, health practices. And so this small survey research was conducted among mothers, teens, young adults, and healthcare providers within this tribal community. And this focused on human papillomavirus knowledge and understandings about how HPV can impact our bodies long after we have an infection. And so they were asked to complete a true false questionnaire about these statements on the left. And you can see the first one: HPV can cause cervical cancer. Obviously, that is true. And yet only about 69% of mothers answered that correctly who participated in this study. And only about 29% of the teens who participated in the study also answered that as true. In addition, also kind of concerning was the fact that only 70% of healthcare providers accurately answered that as a true statement. And so we don't know, why that might be the case for this particular tribal community. It may be that similar to other tribal communities, perhaps there are, cultural restrictions on discussing sexual behavior, or perhaps there are, gender differences in terms of how we understand and relate and share health behavior. And so there's a lot of unpacking that could be potentially really helpful if we're thinking about developing a health intervention for a community like this. I'm wondering if people can maybe check their microphones. I can hear some feedback, and it'd be really helpful if you can mute your microphones so that other folks can not have to listen to those. I also wanted to share that there have been some really terrific culturally grounded interventions, such as the Healing of the Canoe Project, that have been developed over the last 20 years. And this was really, along with several others that are based across Indian country, a result of the support from NIH that actually funded the Native American Research Centers for Health grants, or NARCH grants. And also there is an R01 mechanism and an R21 mechanism now that are available through NIH that also support American Indian Alaska Native intervention research, along with other federal partners such as the CDC and HRSA and other sources of funding that really these research teams were able to leverage and apply for, and were successful in securing, in order to develop projects like this, where it's based on tribal cultures. And the goal was really to prevent substance abuse. But the team, in consultation with their partners at the Suquamish tribe and Port Gamble's Glom tribe, were able to walk through and understand and unpack how can they actually build in those key cultural supports and activities that would really help to promote healing among youth, and also help to improve decisions around behavioral health care and other types of issues facing youth. I also wanted to point out that because of this historical federal program of relocation, there are large numbers of American Indians and Alaska Natives residing in urban areas. And this study by Dan Dickerson and his colleagues at UCLA represents one of the early papers that they wrote about the Makune Project, which is an urban Indian project designed to integrate motivational interviewing and also traditional practices to reduce alcohol and drug use among urban Native kids. And so you can see from the focus groups that they conducted that Native kids in urban centers have been exposed to issues like gang violence and also substance use among peers. They are facing a lack of resources. There are some Native kids who reported, going hungry because there were just no dollars in their household to buy food and to fill up their refrigerator. In addition, they also reported their parents dealing with historical trauma issues. Perhaps they were in a boarding school where they didn't really get a chance to learn how to engage in different parenting skills. I think Christina, I wonder if there's a way for you to mute folks who are not muted right now, because it's a little bit loud, and so I can actually hear folks who are not currently muted. There's things going on in the background that I think everyone can probably hear. And finally, the kids also reported feeling the typical pressures of school and grade concerns, stress about popularity, and also competition within their peer settings. And so this is an example of some mixed methods approaches to really try to understand and map out, what are some of those stressors that urban youth are feeling and being exposed to. And then Dan and his team worked really closely with community partners to then identify how could they build in appropriate cultural supports and other types of approaches, such as motivational interviewing, to better support these youth and be able to address some of these risk factors that they're experiencing.
You have to find a place to plug it in.
I think there's actually a couple people who are not muted, and I can hear them. Okay, great. It looks like maybe everybody's muted now. Thank you so much. This is another study from Maria Yellowhorse Braveheart's work with Lakota elders. And I wanted to include this to point out another important, I think, Indigenous research framework of these intergenerational supports that are key in our tribal communities. And this one in particular was really looking at some qualitative data to try to understand how can we better support Lakota elders. And they found in the study that ways to support them included finding ways to help them help others, and also to support attachment across multiple relationships across the community, to reaffirm and help support those traditional values that are so important within this particular community, and also to focus on future generations and to help identify elders' identity as a helper and a healer. And I think this was really critical because we are all still, moving through different phases in life and understanding our roles in different ways. They're very complicated. They also are culturally informed. And so I think that this was a really great description of kind of what are some of the things that are helpful for elders to recall and reflect on, and also to connect with in order to promote healing and also address perhaps other stressors that they might be experiencing in their community. And this is just a smattering of many different traditional Lakota culture, or not just Lakota, but many different Native culturally informed interventions that are out there. There's many more now because of the NIH R01 mechanism that I mentioned earlier. And you can see that they address issues such as suicide prevention, that they focus on certain groups within the community. So children with disabilities, folks who perhaps are dealing with obesity and related issues with health, as well as ways to reduce the risk of alcohol-exposed pregnancies. And so I wanted to share these citations with you. I will share my slide deck with Christina after I jump off the call. And so if you'd like to explore these in a little bit more detail, I wanted to provide these to you in order to get a sense of kind of the array of different tribally informed interventions that are out there right now. So I went through that really quickly because I really wanted to kind of get to the heart of what I wanted to share with you today in terms of tribally based frameworks. And I think, a lot of this also can be found in the Indigenous studies literature and also some of the early work, that's been done across multiple disciplines in social work and also in psychology and also public health. And so I think some of the common themes that we begin to see when we look at all of these different traditional or tribally informed research frameworks is that there's a tendency and a need that is definitely articulated by the relevant tribal community to focus on relational epistemologies or understandings of who we are, our place in the world, and how we understand the world around us. And to understand also that these relationships matter, they're important, they help to support our emotional health, they may help to support behavioral health decisions or other types of behaviors that then impact health outcomes that we may be concerned about. And so I included a citation from Dr. Greg Cajete, and he talks a lot about this throughout his many publications and what that might look like across different tribal communities. I also think that, when you start to look at many of these interventions that are out there, that place is also centered within these different interventions. And there is a connection that is underscored and supported to land and story and history. And so I included a site there that gives kind of an overview of how that's been done in other interventions that are out there. By doctors Valerie Bluebird Jernigan and also Dr. Rodney Herring, who have done this work with communities that they work closely with. In addition, many of these interventions are grounded in community. And so I'm going to be talking a little bit more about community-based participatory research and how that can be a really good alignment and approach with intervention work in Indigenous communities. And then Dr. Emma Elliott Groves has done some phenomenal work working with her home community. And I think, that's just one citation, but I think that there's many other instances where this intergenerational knowledge sharing that is called out and facilitated and also woven into the fabric of these interventions is also a common theme that we can, understand and adopt and perhaps try with the communities that we're working with. And finally, there are many different Indigenous pedagogies that are applied within these interventions. And Dr. Karina Walters and other folks who have implemented this intervention research within communities that they're partnering with have described, some approaches to doing that with the communities that they partner with. So I want to also focus on, what are some of these approaches that can really help facilitate and help to kind of provide an additional framework from which we can base, our research work with Native communities. I want to share this CBPR logic model, which was developed by Drs. Nina Wallerstein and Dr. Bonnie Duran and other partners at University of New Mexico and University of Washington. And this was really an attempt to kind of understand and unpack how community-based participatory research can help to support these outcomes that we're aiming for in health research. And so before I joined this project, Drs. Wallerstein and Duran worked with their teams to really comb through the literature in public health and social work psychology, business administration, and other areas policy to really think through, what are some of these contextual supports that can help to build out community-based work, and what are some of the partnership processes that are really important in order to ensure that the research is carried out in a way that adheres to those CBPR principles that Dr. Barbara Israel and others have articulated over the decades. And finally, what are some ways that the combination of this contextual element and recognition of how that may influence the research, combined with the partnership processes and the way that research teams are functioning, can then affect how we understand the intervention that's developed and the research that is being implemented in terms of, integrating cultural knowledge, like we've been talking about today, and also helping to empower communities and to really truly ensure that communities are meaningfully involved in the research. And then, the logic model then posits that these outputs of culturally centered interventions and partnership synergy, along with research design that really reflects community priorities, will then help facilitate the outcomes of improved social justice, health and healthy equity, and also in the long-term community transformation. So I'm going to go through that in a little bit more detail here. So I want to break it down into these major groupings that you saw in the previous slide in the logic model. First of all, we have context. And I think that, this is really critical when we think about American Indian and Alaska Native communities in the United States and elsewhere, where there are a lot of federal policies, there is a lot of history, and a lot of issues within our larger society that impact our understanding as American Indians and Alaska Natives of who we are, the resources that we can access and bring to bear to address the health issues that are priorities within our communities, and also that intersect with other issues such as political considerations, policy considerations, the capacity and readiness that we may have available to us in our home communities, and then the historical mistrust of research and other partners across communities that can also inform, how we sort of balance these factors, as well as identify the issues of importance that we really want to focus on in our research. So I want to give you one example just to kind of walk through, how would we think about this if we were wanting to develop a research study within an American Indian community who might be concerned about perhaps intimate partner violence, and we might want to develop or co-develop an intervention with tribal communities within a particular region. And so it may be helpful then to use this as a starting point, kind of a framework to have conversations with the tribal community and map out, what are some of the economic issues that might be at play within your particular region that could potentially impact intimate partner violence. For example, are there resources for folks who are experiencing intimate partner violence that they can access that can help support them in developing a safety plan or moving out of their immediate environment? And are there traditional resources within the community that might be able to help support folks from a culturally grounded perspective? And are there perhaps a history that the community has gone through in addressing this issue? For example, in my home community at Fort Berthold, one of the recent changes in the last 15 years or so has been the development of the Bakken oil fields. And so our history has radically changed as a result of that. We've seen an increase in substance use. Substance use is a risk factor for intimate partner violence. And so that's one example of how a community might begin to unpack with their research partners, some of these issues that are so important, and how to then navigate that with regards to the development of an intervention that is tailored and specific for that particular community. This is one of the key, CBPR principles, recognizing community as a unit of identity. And I just wanted to share this with you because if we are going to explore those contexts, we also have to explore, some place-based issues with our partners in tribal communities and urban Indian communities, and understand, how that might then impact the work that we do together. So I wanted to give you this example of my home reservation, the Fort Berthold Indian Reservation. And you can see there's a dark blue line and then a light blue area. And early in the 1950s, the Army Corps of Engineers built a dam near Garrison, North Dakota, and it resulted in the flooding of most of the bottomlands of our community. And we actually are traditionally agriculturally centered. We grow corn and beans and squash traditionally and still do. And so, for hundreds, thousands of years, we've been using the rich bottomlands of the Missouri River to grow corn. And there are many cultural traditions that are associated with that. And so in the 1950s, when all of this area was flooded out, it forced us to move up to the higher prairie, which is much drier. The climate is not as amenable to growing these types of vegetables. And so it also had an impact on our actual individual communities. You can see that Elba Woods and Shell Creek were flooded out. We had to move many of those folks out of those towns and up into very rural settings where they didn't really have access to relatives and support systems that had been in place for thousands of years. And in addition to that, there are some communities on our reservation that are predominantly Mandan or predominantly Hidatsa or predominantly Arikara, or perhaps a mix of the three tribes that are represented on our reservation. And so all of those pieces, I think, are critical when you're thinking about applying this first principle and wanting to do CBPR informed work to really understand, the community itself. How does the community define itself? How can we understand that as researchers so that we can ensure that we're developing sampling frames that are reflective of our knowledge of this particular community and the community's knowledge of what works. And on the right-hand side of the slide, I wanted to call out King County, which is where I work now at the University of Washington. And I was working with the Enumclaw Family Program, which is a tribal home visitation program based at the United Indians of All Tribes Foundation, a social service organization that has been around now for over 50 years in Seattle. It was, they've just recently celebrated an anniversary, actually. And it was the result of activism here in the community by Native folks who lived in Seattle. And so because of their work now, this institution has been available, and they provide social service programming to urban American Indian Alaska Natives in the county. We didn't really, understand kind of where is our community now. Seattle is a really big, urban center, and it includes many different, townships and neighborhoods across the region. And so what I did in partnership with United Indians teams were to map out, what are those zip codes that have 100 American Indian Alaska Native residents or more, so that we could then understand, how do we recruit for this tribal home visitation program? How do we ensure that we're reaching out to the families who are in need of these parenting supports and child development knowledge in order to better ensure that we're really getting, these services out to our community? And so you can see that on the left-hand side of that map of King County, there are zip codes highlighted in yellow, and those are the communities then that we actually focused on for our recruitment efforts. They also tended to be up and down the I-5 corridor, which is one of the two major freeway systems in our county. And so that was also important to us because, as the name implies, it's a home visitation program. And so we needed to understand, how do we map out the travel that home visitors needed to engage in order to best support these families. And so that was another piece that was very important for our program to be able to plan for, and also to be able to think about sustainability in terms of the costs associated with all that travel. So that's a couple of examples of how to think about, applying this first CBPR principle within Native communities. This is the second CBPR principle, build on strengths and resources within the community. And so this is just a really quick way of kind of thinking about, what are some of those community institutions that may be very different within Native communities as compared to non-Native communities. And so there may be tribal programs like the police law enforcement program, or the jobs program, or community centers that can be really helpful in terms of finding places for intervention teams to meet or to work with their staff. Many other disabilities in terms of ensuring that we're really leveraging, all of the community-based supports that are available to folks who we want to help address, some of the health issues that we face. There's also Indian Health Service. Many tribes have their own health program or health clinic. And so there are a lot of different ways to think about the supports that are available through the federal agency, as well as the tribally based provision of care. Also, we have tribal leaders who are really, the staunch supporters of community work and are able to understand and think about, the focus of our research in a system from a systems perspective, and really understand and map out with us perhaps how to align our work with the tribe's priorities, and to really figure out, how can we ensure that these efforts are sustainable in the long term. So those are just a few examples of how to apply that CVPR principle. This principle is to address health from both positive and ecological perspectives. I wanted to underscore this. This is our Ina McCaw team back about a decade ago, actually. One of the things that was so critical was to include a strengths-based approach. We heard that from the home visitors. We also conducted a mixed methods needs assessment within King County. And that was, one of the priorities that folks articulated in the survey and also in the focus groups. They wanted to talk about issues like domestic violence, like substance abuse, like discrimination in schools. And they also wanted to underscore the importance of, cultural traditions and language and ways to think about the world from a strengths-based perspective that gets away from some of the stigmatization, the discrimination, the racism that Native families had experienced in King County and beyond, that had, huge impacts on their health and wellness. So that's how we ensured that culture was a part of the decision-making process in that particular project. It was complicated because Seattle is the home of over 300 tribal nations because of relocation. There are many, many tribal communities here in the region, in the Puget Sound region. We could certainly draw from their rich cultural history, language, and practices. At the same time, we wanted to acknowledge that there were quite a few folks who moved from other parts of the country, and we wanted to provide support to those families as well. And so that was part of our inquiry during the focus groups as well. And for the most part, what we heard was that folks were really interested in learning about other tribal cultures. And so they didn't necessarily want to just learn about, Hidatsa language. They were interested in learning Salish. They were interested in learning traditional practices from communities here in the Puget Sound. And I think that really points to the understanding across Indigenous communities that place is so important, that relationships are important, and the respect that that we feel for other diverse cultures, and our interest in supporting other Indigenous communities as well in maintaining and revitalizing those traditional practices. So finally, that kind of gets me to the relational partnership processes. And I think, especially in health research, as Native people, we have experienced a lot of trauma, we have experienced harm, and trust is an issue in terms of introducing a new program of research within many Native communities as a result of those historical effects and experiences. One of the things that we learned in the Engage for Equity project that I was able to be a part of was that in order to help address this need to build trust, helping to support dialogue and really truly listening to one another were key ways that research teams could help to bridge, some of those issues among American Indian Alaska Native communities, partners, and also partners more broadly in any community. Some of the most effective CBPR teams also reported taking the time to engage in some conflict management trainings and supports, and also to unpack and understand what leadership means within the particular team. And so we heard some amazing stories, both from folks who participated in our interviews and focus groups, and also from folks who participated in the surveys that were collected, where people were sharing, about all of the very thoughtful, important ways that they were able to structure those types of priorities in their day-to-day research with community partners. And many of those partnerships also reported that their community partners were amazing sources of strategies and practices that were culturally informed in order to ensure that that team members were really truly listening to one another and reflecting and engaging in that reflexivity process in order to move their project forward, and also to be able to meaningfully address the health priorities and research priorities of the particular community that they're working in. In addition to that, we learned that structural partnership processes were also important. So kind of putting our money where our mouth is, ensuring that the dollars that go to our community partners are available and actually cover the costs associated with the research that they're helping to support. That we are also having regular conversations about the CBPR principles and thinking through, how does this particular principle apply to the work that we're doing. Developing formal agreements, such as data sharing and ownership agreements, for example, with tribal communities, was another essential ingredient to ensuring that the team was able to ensure that their work would move forward for the long term. So just checking the time really quickly, because I want to provide a little bit of time for Q&A, and I wanted to share, this is just a little bit more unpacking of the model. Wanted to share a little bit about this particular project that I've had the privilege of being a part of. It's based within the Colville tribes. There are 12 tribes and bands that were co-located on this reservation in northeastern Washington state. It spans, very diverse cultures and a whole lot of really rich natural resources. It's a beautiful area. I've had the opportunity to go out there and visit and learn about all of the medicines and the foods and the stories and mythology from this area. And so knowing that that was just out there and available to the community, we knew that we also wanted to integrate that into the parenting skills program that we were developing in partnership with the tribe. This is another map of all of the different tribes represented at Colville and their Aboriginal territories. You can see that some of them go far into Canada, and also outside of Washington state, and that there are many different traditions spanning many different types of ecological systems and food systems. And so there's quite a bit of diversity that is represented on this particular reservation. This gives you a list of all of the different bands and tribes, and the translation of how they define themselves. And we wanted to acknowledge that as well, because it speaks to these Native communities' understanding of who they are, who they have always been, and who they will be in the future. And we wanted to also build that into how we're thinking about parenting in the long term, because it doesn't just stop with this parent and this child. We know that it carries on across generations. So in the early days of the COVID pandemic, we did a brief survey to understand, what are some of the things that parents were dealing with. And so we provided a survey to 2,000 enrolled tribal members, 18 years and older. It was a sample across the 4 districts that are represented at Colville. These are kind of the 4 major population areas, and we tried to split it across 4 different age groups. And we had about 265 surveys that were returned to us that were undeliverable. And so there was definitely some challenge in terms of getting the surveys out to folks. 203 people returned completed surveys. Obviously, we had a little bit more female representation in the sample, and we also saw that there were some communities that were not as well represented as others, and that we tended to have more older folks completing the surveys as compared to younger folks. However, we did learn that some of the key sources of stress were financial issues that families are facing, physical health concerns about COVID safety, having to navigate and work through family members being sick with COVID, and also housing concerns. In addition, we also asked about practices that people were engaging in to reduce their stress or to help manage their stress. And many folks articulated that they were trying to go outside and be in nature more than ever with COVID, kind of facing this COVID pandemic scenario. They also wanted to ensure that they were maintaining those connections with family, that they were engaging in regular exercise, and also practicing spiritual and ceremonial activities in a safe way. Based on that, then we knew that there was a huge interest in ensuring that a parenting program that we developed would be resonant with the diverse cultural backgrounds across the reservation. We wanted to take an existing evidence-based intervention called attachment vitamins and culturally modify it for families at Colville. And so we were able to conduct a feasibility study before the pandemic hit and sort of see, how people responded to the evidence-based intervention without any kind of modifications. We learned that people couldn't really commit to 10 weekly meetings. They wanted fewer than that. And so we pared down the core elements to ensure that we were able to cover most of the major pieces of the intervention across 6 weekly meetings. They also noted that they needed caregiving support for young children, and so that they could fully participate in the sessions. And we knew also that there wasn't a lot of time that people had to sit and reflect about their parenting. And so we wanted to ensure that people really had that space within the parenting sessions to talk about moments of connection that they have with their children, to share stories, and to also think about, some of these parenting practices that they learned as the child, and also some of them that they carried over and used with their children. And so, one of the priorities for us was to ensure that culture is really centered in this parenting intervention, that we wove in cultural practices, because some folks who participated in the interviews that we conducted after the feasibility study underscored the need to learn cultural practices, that they didn't always have access to them, even though they lived, within their reservation community. And we learned from these interviews that folks wanted additional supports to understand how they could navigate relationships, how could they, talk with folks about parenting and learn from others. And so these are some of the things that, we knew that we wanted to integrate as cultural adaptations into the existing evidence-based intervention. I wanted to share with you some of the things that we learned from the interviews. Folks talked about some of the intergenerational strengths that they experienced from being a child growing up in this reservation community. And this individual from the Language and Cultural Department noted that my mom talks about that nurturing she got from her grandma. And every time she talks about it, I can see in her eyes, I can feel that sweet gentleness of my great grandma. And it makes me feel like a little tiny baby, protected and loved. And we had heard, obviously about many of the different historical trauma and present day trauma that folks had experienced in these interviews. And we also heard about how that love, that respect, that acknowledgement, the relationship was practiced across generations, and how much it meant to people who were describing this to us. And so that was a key component that we wanted to be sure to include, in the skills that we talked about with parents in this program. There was also, a lot of discussion about traditional lifeways within the interviews. When grandparents take you out in the mountains and they want you to follow them and they want to teach you why this is growing that way and why you picked this on that season and stuff like that. And culturally speaking, that's a part of parenting that grandparents and mothers and fathers, we used to come to the country and up in the mountains for weeks at a time and pick huckleberries and things because that's what you're supposed to do. That's just what we knew to do. And so we wanted to, be able to make those types of traditional activities accessible to families today. Perhaps they don't have elders who could help them connect in those ways. And so we wanted to integrate those into our parenting skills program as well. We also wanted to, see if folks really wanted to learn, about traditional knowledge. And I think that this was another key theme that came out of the interviews where folks said, we weren't raised culturally like traditionally, but I do have some aspects of that, of being around my grandparents up here. So I know about what to do during a funeral and stuff like that, but not fully cultural. And I feel now that I'm an adult and I have children of my own, I wish I did know that, because culture is a lot for our members and we just don't have the resources. Like we do and we don't. And so that was another piece, that we obviously felt we needed to weave into the program as well. I think I mentioned a little bit about this before, and so I wanted to just give you a couple snapshots. I'm just doing a quick time check about some of the sessions. So these are the 6 sessions. We wanted to focus on attachment, understanding child temperament and how that relates to our temperament as parents, thinking about our role as a secure base with our children, understanding how to partner with our children, and also how to navigate some of the toxic stress and trauma that we might have experienced or might be experiencing, as well as understand the strength and the resilience of ourselves, our families, and our communities. And so this on the right-hand side is an example from the parent guide that we make available to parents in the sessions, and to kind of understand, what are some of those needs that children are having. And we wanted to also relate it back to the tribal community. And so this is just one example of how we did that, to use honor, the word honor, as a way to recall, what are some of those needs and how can I address those needs that my children are experiencing. We also wove in these cultural pieces. This is an example of a cultural handout that we made available to parents. And these are little cards. This is just a snapshot of one card. We also have a full page description of like 2 or 3 pages of traditional stories, ways to pick plants respectfully. And so this is just a way of kind of how we thought about, making traditional languages available. This is Okanagan, and how to also think about, what are some of those traditional practices and how do we find, some of these medicine plants and food plants that our ancestors relied upon for sustenance and for healing and growth. So, we offer these sessions in a group format. We're currently undergoing testing of the culturally adapted version of this. We had it reviewed by cultural and language department members to confirm the language, to confirm, was it okay to share some of this knowledge more broadly. We also, wanted to ensure that we were sensitive to the fact that, there's multi-generational healing that probably needs to happen. We didn't want to re-traumatize anyone, but we also wanted to make some of this knowledge and information accessible to folks who might not normally have it available in their day-to-day lives. And so we've also been having conversations about what would be the appropriate place within the community to make sure that this program lives on after the research project is completed. And, we're having conversations about perhaps integrating it into the Reservation Head Start program, for example. So I know that was a lot. I did a lot of talking, and I want to make sure that we have a few minutes available for questions and comments. And so just in closing, I think there are some amazing pieces of work that are going on out there in Indian country across many different research programs and teams. There are many cultural supports that are available. And we know that we come from diverse communities that have some similarities. And yet we also have, some very important differences that need to be acknowledged and addressed when we're hoping to tailor these supports for particular communities. I think, one of the things that I've heard just throughout all of the different projects that I've had a privilege of being involved in is the strong interest in passing down this knowledge to children to understand identity development through Indigenous lenses across generations, and the belief that these strengths will then result in our own healing and continued resiliency. This is an example from the Coeur d'Alene tribe. My husband is Coeur d'Alene, and so during the pandemic, we have been trying to learn our native languages. I have a Hidatsa Zoom class that I jump on Saturday mornings with my parents and Hidatsa language speakers. And then my husband is learning Coeur d'Alene from some teachers in his community. And I just wanted to share this with you because I think it really exemplifies some of the efforts that are going on out there. This is kind of a diagram of relationships in Coeur d'Alene. And so any one grandchild could be called 4 different terms, depending on which grandparent is talking to them. And so this one grandchild could be called Kihipe or Kikine, depending on whether it's their paternal grandfather or grandmother talking to them, or Sisile or Chichie, depending on if it's their maternal grandfather or grandmother talking to them. And the reason why I share this, what I learned as I was learning Coeur d'Alene, was that if you repeat syllables like that, it means something that is just so cute and adorable and loved. And so I think that these terms for grandchild really exemplify those connections across generations. And so the paternal grandfather calls all of his grandchildren Hihipe, which is beloved, tiny, cute grandfather. And similarly for the other grandparents as well. And I think that for me also underscores the urgent need, really, because we're losing native languages every day, to work hard at learning and revitalizing and integrating these key Indigenous understandings and teachings into the health work that we're doing, in order to ensure that not only people have access to this really rich cultural foundation, but they're also living how their ancestors conceived of the world around them, and the relationships that are at the core of who we are and who our children will be on into the future. So with that, I will stop sharing and just pause to see if folks have any questions or comments that you'd like to share before we close out today.
Bonjour, I have a question.
Yes, Barb, is that you?
Yes, hi. Just more and more tribes are creating IRBs. And so do you have any advice or tips on how, following their process?
That's a great question. And I've worked with several tribal IRBs and also tribal college IRBs, as well as RRBs that are, developed through tribal code. And so, the folks who do that work are just so generous and they're so thoughtful. And I really encourage you to reach out to maybe your local tribal or tribal college IRBs or RRBs and have a chat with them about how do they make it work? Because honestly, they are kind of the bulwark of research in Indian country in many ways. The people who are doing the reviews are doing it for many times for free. They're volunteer. They're driving thousands of miles every year to meet in person, to go through our hundreds of pages of research materials, and they're making it work. And I have served briefly on tribal IRBs in the past. And I didn't have to do any of the coordinating. I just kind of showed up and they gave me the materials to review, and I was happy to pitch in and spend time with them and provide, my thoughts. But those folks are really doing it. Like, they're the ones who are organizing all of this and making it happen. And so that's what I would say. I would encourage you to reach out to some of your local IRBs and RRBs and just have a chat with somebody there, because what I've noticed is that they're so willing to talk about this, and they're so giving of their time and materials. And so that would be my recommendation. Hi, Don. I don't know if you'd have any other recommendations.
Yeah, just first of all, thank you so much. That was really tremendous. And I agree. It's so good to see more tribes developing their own IRBs, some that are actually getting formally registered and recognized legally as IRBs, and some have more informal research review boards. I think the important thing to keep in mind is that each tribe is different, and their processes will be different in terms of how we get approval. But it's so vitally important, as you say, to get the approval on the front end before getting the research project started. So it's wonderful to see this expanding. And I think whatever we can do in academics to support tribes in developing their own IRBs and RRBs, the better. And then, of course, the next step is also to ensure that the tribes are setting their own research agendas as well and identifying their own priorities. So I know that, Dr. Parker, I know this has been an area that you've worked in extensively and doing that genuine community engaged research. So no formal question, just wanted to say thank you and really appreciate it. But it looks like Delight Setter has her hand up.
Okay, I have my hand up. I have to turn on all my valves. And I hate to have my hand up while I'm speaking. It's so great to see you, Myra, and to you, Don. Thank you so much for recognizing my little hand. And of course, everyone should know that I'm actually a Husky. And so when I look at those cherry blossoms behind you, I not only think of the beautiful campus I had the privilege of walking around, I think of the Japanese who were interned. And so, like, to me, that your background is a sacred image. Not that mine isn't. Where am I? Like, that's the earth. So that's pretty sacred too. So I really was most intrigued with the I-5 corridor. I grew up in South Puget Sound, among the Nisqually and the Puyallup. I'm Grand Round from Oregon, but a lot of people moved north during the whole Boeing expansion and, Kenworth expand. A lot of people moved from California or in Oregon into Washington before I was born. And then we've made our life there. And it is great to see that you're doing work among Indigenous people along, really, they call it I-5 corridor, but it's the Puget Sound, right? It's along the waterway that people in the canoe journey traveled. So thank you so much for that. And I really didn't know that that work was happening out of the CHRC. So, and of course, I've worked with Fort Berthold on some physical activity kind of work in my past. But I was just really thankful. I thought it was quite a whirlwind tour of topics and public health and CBPR. And you kind of spent a few bits or a few minutes on each area. And my goal, like, I'm thinking I want to go deeper. I want to hear more about each and everything. And of course, I'm happy to work with you and our partners on Indigenous social determinants of health, because that does weave across all of those areas. So I was just wondering if you could talk a little bit about that. And I've also dropped in the chat a link to a recent publication by our elder and dear colleague from, all the way back to the 70s, Linda Burhan Stepanoff, who is like the queen of health education. And I thought we should honor her today as well, because your work that you're talking about is connected to her work back the last, I don't know, 50 years. And, she established minority health at NIH. Do you know that's so for all of our people, I'm really into this across generation stuff right now. And so just so everyone who's in their 20s know that our Cherokee, I'm not Cherokee, but a Cherokee elder, Linda Burhan Stepanoff, helped establish women's research and minority research at the National Institutes of Health. So I dropped that link, but really I was just hoping that you could talk a little bit about Indigenous social determinants of health and how that interweaves across all of the work that you're doing. And of course, I do appreciate your work that is sprouting out of the University of Washington.
Thanks so much, Delight. I really appreciate your comments and the resource that you shared. Yeah, I know we're a little bit over time, but just briefly, we are really thrilled to be able to partner with the CDC, not only Delight, but some of her colleagues at the CDC on mapping out Indigenous social determinants of health and what that looks like. It's not a research study. We are holding kind of listening sessions where we're asking community members to share with us ways that they see the environment that they grew up in and live in day to day impacting their health and well-being. And so we're really thrilled to be able to share about that very soon. I think in the next few months, we'll be launching a website on our web. It's affiliated with the Indigenous PHI website that we have. It's I can drop that into the chat and also share it with Christina so that you can maybe email folks. I know other folks asked for the resources, and I'm hoping that there's a way to get that out to everybody who's on the call. It's in the slides. I didn't go to that slide because it's literally like 10-point font and just like a lot of links. But I wanted to definitely make that available along with our website. So I'm sorry, apparently I can't type and talk at the same time, focusing on my spelling. So you can check us out maybe in a couple of months, and we should be able to bring up the Indigenous Social Determinants of Health project in more detail. And what we did was we sent the transcripts to a graphic artist, and then she was able to draw the connections of all of these different social determinants of health from an Indigenous perspective and link them to outcomes that community members are interested in. And so I'm hoping, in the next several months as well, we'll be able to sit down with her and do this across the different groups that we were able to have listening sessions with, so that it's not just one tribe or region, it's kind of weaving it all together across all of the different folks who participated in those discussions with us. So thank you so much for highlighting that work.
Thank you. Thank you so much.
It's been such a pleasure sharing some of the things that we've been working on today. I know we're a little bit over time, and it's really awesome to see all these familiar names in the presentation. So thanks so much for taking the time to join today and to listen in. And I hope that this was useful and helpful for you and your work that you're doing. I know you're all doing amazing work within your communities as well. And so just want to appreciate you and give a shout out to you all. And Dawn, thank you so much. It's wonderful to see you on Zoom. Hopefully we'll get a chance to catch up sometime in person again.
I agree. Thank you so much for the wonderful presentation, and thanks everyone for participating. This was great. Thanks again.
Take care. Mods to get odds.
Masi.